Hair transplants were invented in the 1950s and the technique has come on leaps and bounds since then. Hair transplants are now considered a routine surgery with over 650,000 being carried out every year, but as with any surgical procedure, there are potential side effects. You won't walk out of the clinic with your dream hair straight away, and you might experience pain, bleeding and other uncomfortable symptoms. Express.co.uk chatted to the team at Premier Hair Transplant Clinic, Fway Clinics to find out about the side effects of hair transplants. Almost half of UK men and around 8 million women in the UK experience hair loss, but these people don't have to let the upsetting process run its course. There are lots of different types of hair transplant. The most popular are Foot and Fway, to pick from and endless high-quality clinics across the nation to choose from. If you want to transform your hairline and patch up bald spots, hair transplants seem to be the way to go. However, at least £4,000 to £6,000 ago, this surgery doesn't come cheap and it's important to know the realities. While hair transplants can be life-changing, it's not all plain sailing and you might experience some unpleasant side effects. The team at Fway Clinics pointed out, not everybody will experience these side effects, and they will likely be very minimal. However, you should still be aware of them if you are considering this procedure. Here are the 8 most common side effects that some people experience after a hair transplant. Hair shedding. Ironically, the majority of hair transplant clients will lose a significant amount of hair at first. This process is nothing to worry about and is referred to as shedding. Transplant hairs will fall out for around 2 to 3 weeks and the regrowth will be visible after 3 to 4 months. Bleeding. Due to the nature of the surgery, there will be small incisions on your skin which will result in blood loss. The majority of experienced doctors will make sure that your blood loss is minimal and where possible, they will control this with gauze. It's important that you inform your surgeon if you are taking blood-thinning medicines or suffering from bleeding illnesses. Itching. Itching is a very common side effect and happens because of the small scabs that form at the transplant site. The easiest cure is to spray a saline solution over the grafts and wash the scalp with baby shampoo a week after the surgery. Don't panic, the itching should go away within a few days. Swelling. This is another common side effect, but the swelling will vary from person to person. Some people may experience swelling on their forehead, while others may get it around their eyes. In some cases, you may get black eyes. The swelling will start to wear off after a few days. If it doesn't, we advise that you contact your doctor. Swelling is completely normal, as long as it is not hot to the touch and doesn't get worse over time. Pain. As with all surgeries, you should expect a small amount of pain from the procedure. In the majority of cases, your doctor will provide you with anesthesia and sedatives, and will also prescribe you pain medication to avoid pain over the post-op period. Infections. Chances are you won't get an infection, especially if you choose a good surgeon and a high-quality clinic. But in some cases you may get a slight infection. If this is the case, antibiotics will be prescribed at the discretion of the surgeon. Scarring. If you have had an Fway hair transplant procedure, then you will have very small micro scars. They will disappear in a few weeks. When new hair grows, the dot marks will be hidden. If you have undergone a foot hair transplant, then you will have a linear scar. Proper hair growth will cover this, so there's no need to worry. Cysts/folliculitis. Cysts will happen when buried grafts aren't removed properly. Mostly, cysts will appear like a cluster of pimples. There has only ever been a few cases where they are aggravated. Cysts will disappear over a few weeks, however. If they don't, we recommend talking to your surgeon.